Hello everyone, and welcome to a new video and a new series I like to call DPT Clinical Survival Guides. In this type of video, I want to share from my personal experience in clinicals exactly what goes on in the different settings as well as specialties within physical therapy and how to succeed in your clinicals within those areas. Now let's get into our first setting, acute care. I want to start off by giving an outline that we can follow throughout the video. It will have some timestamps so that if you want to jump around and figure out exactly what you want to know from this video, feel free to use those. First off, I'm going to talk about the physical therapist's role within this setting. Then I will talk about a few of the professionals that you may work with and what part of your job as a physical therapist they may help you with. I'm going to touch really quickly on some codes, the communication system that hospitals use. I'll talk about how to prepare for the day, talk about rounds, how I approach chart reviews, what to look for in your pre-encounter basics, how to approach a subjective interview with a patient in this setting, talk about some things to remember in the patient encounter as a whole, and review all of the key points to make sure to impress your CI. When I think back to physical therapy's role within acute care, I really started to think of physical therapists as the mobility experts. We were the ones mainly focusing on the lower extremities, thinking about things such as gait, transfers, as well as assistive devices to help our patients access their communities and their homes. On top of this, we would provide a lot of patient and caregiver education, along with being an integral part of the discharge plan as a whole, including occupational therapy. Now, I just mentioned occupational therapists, one of the professionals that you will work with within this setting. However, there are a multitude of other individuals that you will work with that I just want to go into a little bit of detail on who they are, as well as what they can do for you from a physical therapist standpoint. The first of which are going to be your medical doctors, your doctor of osteopathic medicine, or your physician assistants. These are going to be the ones who are writing the orders for physical therapy to initiate, for braces for your patients, for the post-operative precautions that you need to keep in mind throughout the sessions. Two other individuals that will be really important on your floor are going to be the charge nurse and the steps nurse. These two nurses are essentially the head nurses on the floor or unit that the other nurses will report to. They also play an important role in coordinating both the admission and discharge of patients to each floor and unit. Now, just below these charge and step nurses, you have the resident nurses and CNAs. These are going to be the ones who are assigned to specific patients throughout the floor. You can talk to them in order to get a general picture of exactly how a patient's mobility has been recently, as well as making sure to administer pain medications before your sessions, or just talking about medications with in general before you start an encounter. The case managers commonly are resident nurses, and they are the ones who take the recommendations of physical therapy as well as the wants and needs of location for the patient to work with insurance to get authorizations for discharges to subacute facilities or inpatient rehab facilities or things like that. They are that intermediate of taking the recommendations from the rehab team as a whole and meeting the patient's needs. The occupational therapists, or OTs, as I mentioned earlier, are the ones who really focus on the upper extremity. They can give you some of that more detailed insight as therapists as well into mobility, especially when they're working with the same patients for activities of daily living and sometimes cognition. Mobility techs are some of the last individuals on the team that you can expect, which are the ones that help the patient that you have after they clear physical therapy and occupational therapy. They're the ones who get the patient moving and maintain their physical fitness until they are medically cleared or off of pain medications that they need to be off of before they're able to discharge. When you're new to acute care, All of the different professions can be a bit confusing on figuring out who is who, but the nice thing that happens most of the time in hospitals is that each profession has a different scrub color. If you can figure out which scrub color is which profession, you can get an idea of who you're working with at that time and can really help jumpstart you when you're having trouble remembering people's names right in the beginning of your time in your clinical. Now, in most hospital systems, if not all, they have a coding system to communicate different things. These can be things from a fire, from a stolen child, from cardiac or respiratory distress. Just make sure that you ask about and know the code system so that when you hear, for example, a code red, you know that that is most likely a fire and that you should be evacuating at that time. When I would start each day, I would make sure to have a pen or pencil with me, a notebook or clipboard, my water, some snacks, as well as some comfortable shoes as you will be on your feet for a majority of the day. Now, when I started off the day, I would make sure to print off my patient list, as it would be kind of my home base for all of the information I needed for the day. Once I printed that out, I did a quick chart review of each of the patients on there so that I could prioritize exactly who I would go to first and who would be left for last. Most of the time, priority comes first to those who are discharge pending, as well as those who are evaluations or re-evaluations. So keep that in mind when you are trying to prioritize your patients. Now, once I had this, I made sure to find the list of the nurses for the day and figured out who was assigned to my patients, made sure to write them down on my patient sheet, as well as their call number so that when I would call them before each session, I would have everything in one spot. One last important thing to do is to check the rounds to see if anything had changed from the notes that you saw based on the conversations they had this morning. For those who have not been in acute care or subacute care before, rounds may be a new concept, but essentially it's just a quick meeting in the morning where all of the individuals from the care team that I mentioned earlier come together and figure out the collective discharge plans, the mobility assessments, the subjective portions, the missing orders or equipment orders that need to be done for each patient on the floor or the unit for that day. It's just a quick time to get everyone on the same page so that the day can be very productive. These are a couple of the things that I made sure to note when I was looking through the chart before I would go into an encounter. The first of which is make sure you know what their admitting procedure or event was. You should also keep note of their age, their height and weight, as this can be important when you're thinking about what assistance you might need when doing transfers. You should also make note of any language accommodations there may be. You should make note of any weight-bearing precautions, movement precautions, aspiration precautions. You should make sure that if there are any brace orders in, you understand what the brace orders are. You also want to make sure that you check their recent vitals, see if they have any upcoming procedures occurring, as that can change your priority, or it can also give you context into what complications they might have had since the last time you saw them. And then finally, make note of any relevant comorbidities that may affect your care to this patient. When preparing for your encounter, you should make sure to do at least two big things. The first of which is call the nurse that is assigned to the patient. This will provide an opportunity for you to have a short conversation about when they have had their last pain medications. It can let you know about their recent mobility, how they're feeling for that day overall, as well as any different complications the nurse has had working with that patient for the day that you can keep in mind before you start your session. Second, you want to make sure that you have everything you need for the session. This can include grabbing any of the vitals machines or equipment that you might need to take vitals. It can include towels for exercises or positioning that you might do throughout your session, or any assistive devices you may want to trial or you know you will need for your patient. Knowing that one of the main roles of physical therapists within this setting is discharge planning, you should make sure to kind of target your questions within the subjective interview to hit some of those points that can help you prepare yourself for whether it's good for them to discharge home or to go to a facility. So here are a couple of the questions that I ask to make sure that I can get a good amount of the information I would need to know for sure. The first of which is to ask what they do for a living. This can include work, hobbies, what they do for fun, anything that they do on a daily basis. You should also ask them what their living situation is, who they live with, and what those individuals they live with do so that you get an idea of how much support and when they might get that support, who they care for in terms of kids, pets, possibly older parents. You should ask what their home looks like, how they get into the home, do they have a ramp, are there stairs, do they have handrails on both sides, what does their bathroom look like, do they have grab bars, do they have an elevated toilet seat. All of these are crucial. You also want to ask them how much assistance they have with transportation, errands, housekeeping, if they're independent with those or not. You also want to ask if they were using any assistive devices or equipment for mobility around their community and or their home before admission. And you also want to ask them the classic question of if they have had any falls in the last 6 months so that you have an idea of the safety precautions you might need to keep with this patient. The acute care environment can be overwhelming and complex, so it's good to think ahead of time exactly what you need to think about when you're in a patient encounter. The first thing that I would suggest thinking about is making sure to turn off the bed alarm before you start a session and remember to turn it on again at the end of the session. If you don't, you might start mobilizing a patient and have alarms going off, and the nursing staff will be coming in, and it can create a bit more trouble than you were hoping for within your session. So just make sure to keep that in mind, because almost always individuals in acute care will have either a seat or a bed alarm that is on, because most of the time these individuals are in critical condition and we don't want them getting up because it might be unsafe for them to do so without supervision or assistance. Another thing that's important to keep in mind is figure out what tubes and wires are attached to your patient and where they're coming from and where they're going. This can help you plan ahead of time when you're thinking about mobilizing your patient for the session, or even tell you what you might not be able to do given the circumstances and where each of those things is placed. Now, the last thing that's really important is think about throughout the session to help yourself later on with creating your progress notes, what you're doing with a patient that is skilled. This can come from thinking about the gait mechanics that your patient is using, thinking about what verbal or tactile cues you provided to them in order to help with a deficiency or issue that they were having. You should keep note of any of the patient or caregiver education you provided throughout the session, as well as keep in mind the level of assistance you're using during each of the actions, whether it's during walking, whether it's during transfers, whether it's during exercises. Just keep it in mind because it will really help you down the line in being more detailed in your notes, which can be helpful for both you, your coworkers who might also be working with this patient, as well as any of the authorizations for insurance, as they can truly see the level of assistance that is needed, and it can provide that really quality evidence to that insurance company on why it is necessary for them to go to a place that you are saying they should discharge to. I hope you all enjoyed this relatively quick overview of acute care and physical therapy. If you want to have a quick review of exactly the key points that we went over today, you can check them out right here. If you enjoyed, make sure to like and subscribe down below, as well as comment anything that I missed that you feel other student physical therapists would find helpful going into their first acute care clinical. If you want to see more videos like this with the DPT Clinical Survival Guides, make sure to let me know what one you're excited to see next. Thank you all so much for watching. This has been KP DPT, and I'll see you all in the next video.